There's no easy solution to the problems that have come to define the area known as Mass and Cass around the intersection of Mass Ave and Melnea Cass Boulevard, where homelessness and opioid addiction has become ubiquitous after the Long Island Bridge closure cut off access to key services. As we told you last week, former Mayor Marty Walsh wanted to find a way to help those who needed to get back to Long Island, but the mayor of Quincy, where the route to the island begins, was not on board. And as for acting Mayor Kim Janey's more recent proposal of turning 30 rooms at a Revere hotel into a transitional homeless center, well, here's what Revere's mayor said to us about that last week on the show.
30 beds isn't a plan. 30 beds is a Band-Aid on a situation, a crisis in the city of Boston that needs real leadership and real support.
Now the sheriff of Suffolk County has entered the discussion involving an empty detention center inside the South Bay House of Corrections. Sheriff Stephen Tompkins joins me now to explain. Sheriff, it's good to see you.
Good to see you, Jim.
Could you explain briefly what's your plan?
So there have been ongoing discussions between my department, the residents of the South End, and the Newmarket Square Association, basically saying, how do we work collaboratively to get people off the street? I have a building here that used to house ICE detainees a while ago. It's now sitting vacant, and I can house up to 100 people. And so I said, well, look, why don't we open up that facility? I have a full-blown mental health team. I have a full-blown substance abuse team. Bring folk in, get them off the street, get them cleaned up. What I mean by that is have a shower, a meal, a bed, and treat them, help them with their medical needs. And then let's start the process of where do they go from here.
And would these be involuntary commitments, by the way, Sheriff?
What we're looking at is people that already have a warrant. It makes it a little bit easier if they've already touched the legal system. Involuntary commitments or civil commitments is a tougher road to hoe.
So even for those who support your creativity, what's the response to a jail is still a jail? How do you disabuse both members of the public who are concerned and the people who would be there that this is just not another jail?
I can't tell you how many parents have said to us in years past, I wish my son or daughter were in jail because at least we know that they were off the street and getting the care that they need. And that's what we've been hearing a lot this past couple of days, Jim, is that people are like, yes, let's do something now. There are also naysayers that feel that people shouldn't be in an incarceration facility. To that, I say, talk to legislators about putting more money out on the street to create beds for mental health and substance abuse.
How close to an incarceration facility would it be under your plan, Sheriff?
Well, it's on my campus. So, but they would not be housed in the same buildings. So we're talking, I don't know, maybe 500,000 yards away, but it's in the same, it's on the same campus.
I know you've been asked about a woman, Aisha Johnson, I think her name was, who was civilly committed for treatment there, who died on your watch. Why should that not discourage people from buying into this plan?
Well, but first, she wasn't civilly committed here for treatment. Here's what happens. When you go to court, the sheriffs are basically the Uber for the courts. And so we have to move people from the courts either to a correction facility or wherever they're going, if they're going to a shelter or someplace to take care of them. She was waiting for a ride to leave from our department to go to where she was going next and expired then. Here's the rub. She was what they call Section 35 or civilly committed, but she's not under my jurisdiction. When that happens, because of Section 35, I cannot give her a medical assessment. When someone is under my jurisdiction, as soon as they come in, we see what their mental and physical situation is. And if they need to be housed in an infirmary, we will do that. With Section 35s, we cannot do it. Legally, we can't. And so she was sitting there waiting for a ride.
You said you consulted with some people in the community and others. Obviously, even the best of ideas go nowhere if they don't have political support. I think I read in the Shirley Young's piece in the Globe, you had spoken to Secretary of Health and Human Services Sutters. What kind of response did you get from her?
I think she's a willing participant. I think she's going to do, and I think the state is going to do all that they can because they see the situation's out of control. Marty Martinez, who heads up Health and Human Services for the mayor, visited the department today. And so the city and the state, along with us and others, are saying we have to do something before the really cold weather gets here.
Well, there are also two women running for mayor, one of whom you've endorsed, Michelle Wu. Starting with her, what is Councilor Wu's response to your plan?
Tell you the God's honest truth, she's been running for mayor, and I've been doing this. I meet with her later this week, and so we'll have a conversation about that. But I think that she's in favor of the fact that we're working to get people off the street.
How about you haven't had a chance to speak to Councilor Asabi George, I would assume, either. Is that correct?
No, but I'll tell you what, Anissa's been down in this area about 3 or 4 times. So I think that she would also be open to getting these people off the street.
How soon are you ready to go if you got the sign? Who do you need to get a sign off from, by the way? I should have asked that first. Who would you need to buy into this?
Right. So here's what happens. It would be the courts and the district attorney that would determine which people can come here. So that would have to happen first. There's a couple of things that we have to do on our physical plant that would probably only take a couple of weeks to get taken care of. But it really is the courts and the DA. And so they make the move first, and then we follow up.
Rachel Rollins, is she on board?
Yes.
She has bought into this.
You know, you want to talk to her about how fully she's bought into this, but she, in our conversations, definitely sees the need for getting people off the street and getting them some shelter. Yeah.
You know, in the last minute, I'm going to ask you a question about in a perfect world, and I assume you're going to interrupt me and say this is not a perfect world, and I would do the same. But in a perfect world, would we even be considering putting people from a place like Maston Cass at a former detention facility? Or is this not just a product of complete exasperation and that kind of thing?
Well, as you opened up, we don't live in a perfect world. And therein lies the problem. If, in fact, we spent our dollars, our governmental dollars in front of the curve versus behind the curve, we wouldn't be having this discussion, Jim. But we don't do that. And so now we're behind the curve, and now we're trying to run to catch up.
Steve Tompkins, it's good to see you. Thanks so much for your time.
Thank you, sir.